Hi, I'm Melissa Brooks.
And I'm Kristen Diaruta-Wharton.
We're both nurse practitioners at Sawtooth Mountain Clinic, and we're here to talk about the HPV vaccine, also known by the brand name Gardasil 9. We'll talk about what it is, why you should get it, and who should get it.
HPV, or human papillomavirus, is a type of infection that is spread through intimate skin-to-skin exploration or sexual contact. Most HPV infections will go away on their own, but if the virus stays in the body for a long time, it can cause cancer later in life.
The HPV vaccine protects against most cases of cervical cancer. It protects against cancer of the vagina, vulva, penis, or anus caused by HPV, as well as mouth, throat, head, and neck cancers caused by HPV. The HPV vaccine can prevent over 90% of cancers caused by an HPV infection.
All people ages 9 to 45 can get the HPV vaccine, but it's recommended that children get the vaccine at age 11 or 12 so that they're fully protected years before they become sexually active or begin exploring.
The HPV vaccine is a series of shots. People ages 9 to 14 only need to get 2 shots 6 months apart.
For people ages 15 to 45, the HPV vaccine is 3 separate shots spread out over 6 months.
The HPV vaccine is one of the most effective vaccines you can get. It works best when you get it years before you have any sexual contact with another person. If you get all the recommended shots of the HPV vaccine before you have sex, it can lower your chances of getting genital warts and cancers caused by HPV by up to 99%.
However, if you've already become sexually active or know you've had HPV, it's still a good idea to get the HPV vaccine, as it can protect you from other strains of HPV that you haven't been exposed to yet. The vaccine won't treat any current HPV infections.
Studies show that the HPV vaccine gives long-lasting protection against HPV. Since the vaccine was recommended in 2006, rates of HPV infection, cervical precancers, and other related cancers have gone down significantly.
Research shows that the vaccine is safe. Side effects do tend to be mild, and the most common side effects of the HPV vaccine include soreness, swelling, or redness at the injection site.
Because the HPV vaccine prevents a sexually transmitted infection, some people believe it's inappropriate for children. However, the vaccine works best if you get it long before becoming sexually active.
There are also studies that show that the HPV vaccine does not lead to people having sex or more sex at a younger age. Giving kids the HPV vaccine does not encourage them to have sex, but it does protect them from cancers caused by HPV later in life.
The HPV vaccine is just one way to protect against HPV infections. Even if you were vaccinated, Pap smear test and HPV test are still recommended to find and prevent cervical cancer. These screenings begin at age 21.
The HPV vaccine is available at Sawtooth Mountain Clinic. Talk with your provider to find out if the vaccine is right for you or your child. If you have concerns about paying for services, sliding fee scale is available, and you can inquire at the front desk to see if you qualify.
And if English isn't your first language, we offer an interpreting service with over 200 languages.
Thanks for watching. We hope that this has answered some of your questions about the HPV vaccine.